We have one more presentation, and it's around financial assistance. And you may wonder, why did we put this session last? And, you know, after we've done all of these good things. It's not because we think it should be last, but we have an online audience, and you put out financial assistance, you don't get a little attention. Everybody want to know, how do I get the money? So we think this might be a good way to keep our online audience alive and with us throughout the program. So those of you online, if you're still with us, it worked. So at this point, I would like to bring up the Patient Advocate Foundation. They offer some creative approaches to providing financial assistance to patients. And we have with us today Ms. Michelle Herbert. Please give her a hand.
Morning, everyone.
Good morning.
We actually learned that trick as well about speaking about financial assistance last. So I'm first going to talk about our case management services, which offers no financial assistance, to keep you guys tuned. But first of all, thank you so much for having me, and I'm excited today to talk about just some of the services and programs Patient Advocate Foundation offers. We're going to talk about our partnerships, our copay relief program, our rather new radiation copayment small grant fund, and additional services that our case management staff offers. So who is PAF? Our organization started in 1996 by our founder, Nancy Davenport Ennis, who, after assisting a dear friend of hers that had been diagnosed with stage 4 breast cancer, her name is Cheryl. She was actually denied enrollment into a clinical trial by her insurance company after she had exhausted all other treatment options. She was the mother of a 9-year-old child and had no other family support, and Nancy was really there as her caregiver and her advocate to help her navigate through the healthcare system. And after that, Nancy realized that this just doesn't happen with women. This just doesn't happen with breast cancer patients. This just doesn't happen in North Carolina, where she was at the time. This is happening throughout the nation. This is happening to patients that are battling all chronic, debilitating, or life-threatening diseases. In 1996, when the organization started, the case managers assisted about 127 patients. And in 2013, over 100,000 people received direct patient services from our organization. We do have offices throughout the country, home-based in Hampton, Virginia. We have home offices in Florida, North Carolina, Iowa, and California, and a small satellite office in San Antonio, Texas, which houses the majority of our bilingual case managers. Oh, sorry. We have about 21 programs and initiatives, but I decided to narrow this presentation down to about 3 or 4. We have partnered with several organizations like the American Cancer Society, Livestrong, pharmaceutical companies, to develop programs like copay relief, support programs like our case management services, and we also provide outreach to, with our National African American Outreach Program and our National Hispanic Latino Outreach Program. So the core of our organization really is case management services, because we all know, I don't know, as providers, as caregivers, we've probably realized in the prostate cancer community, financial resources are very, very limited. So this is where case management services comes into play. The foundation seeks to safeguard patients through effective mediation, ensuring access to care, maintenance of employment, and preservation of financial stability. Many of our patients are newly diagnosed, and when they get the diagnosis of prostate cancer, it's what's next. I have health insurance, I may not have health insurance, but what happens now? How do I pay for this? How do I pay for my deductible? How do I pay for my coinsurance? How do I tell my family? So this is where our case managers come into play. Our case managers have diverse backgrounds. We have registered nurses, licensed clinical nurses, billing and coding experts, Social Security disability experts, as well as experts in benefit programs like Medicaid, Medicare, SNAP benefits, and things of that nature. So when a patient first reaches out to our organization, they are connected with a medical intake specialist who performs a brief intake to get a little background on their diagnosis and their needs. And after the case is initiated, we have reviewers that connects the patient to the case manager that best suits their needs. Our services are free of cost. We don't discriminate on insurance status, age, gender, ethnicity. We do assist patients within the United States or U.S. territories at this time. We have not moved out of the country, unfortunately. Again, we assist with a broad range of diseases. While the bulk of our patients do have cancer, we also help with other chronic diseases like diabetes, hypertension, autoimmune diseases as well. So when we think about cancer treatment and financing cancer treatment, our patients are either uninsured or insured. For our uninsured patients, the question that we ask is why? Why haven't you enrolled in health insurance? Are there any health insurance options available to you? And what we mainly find is before the Affordable Health Care Act, our patients that were already diagnosed and did not have health insurance had no access to health insurance because of pre-existing conditions. So now with the Affordable Care Act, our case managers have been able to enroll many individuals into health insurance programs. The unfortunate or the flip side to that is many of our patients are low income and can't afford to pay the premiums and may not be income eligible for the subsidies that are in place. So our case managers then look into programs through their city, their state, their county, like county medical assistance programs, financial assistance programs through the provider or university or research hospitals in the area in order to ensure access to care for their patients. Some of our patients are literally shocked when they find out the cost of cancer treatment, even with health insurance coverage. And so we don't think of insured patients having difficulty paying for treatment. I've been diagnosed, I've been given a treatment protocol, I have health insurance, so here we go, let's go. So our case managers who work with insured patients really work with a patient and their insurance company to review their benefits with them to make sure that they don't get a $3,000 bill in the mail and are shocked because they have to pay a deductible before their insurance will pay out for medications or radiation treatment or chemotherapy treatment. This new concept of I'm insured, but I'm really underinsured because my health insurance may have capped benefits, large copays and deductibles again. So our case managers, if our additional programs through copay relief or the Radiation Small Grants Fund are not able to assist our underinsured patients or our uninsured patients, our case managers will actually go outside of our organization to screen and enroll patients for other programs that may be available to them. So again, with the uninsured patients, we're looking at Medicaid, we're looking at county medical assistance programs, we're looking at medication assistance programs through the pharmaceutical companies, and we'll actually take an active role in applying for those programs for the patient. Many of our patients are sick, they're ill, they may not have a caregiver that can apply for programs for them. So that's where our organization steps in. We have experts in the healthcare marketplace. I know this has been on the news where there were some problems with the website or it was a little confusing. So we do have experts and case managers that can assist with the entire enrollment process for our patients as well. And that's screening, that's actually enrolling into a program and all the way until completion. We've also developed several brochures that educates patients on the marketplace and health insurance options through insureustoday.org. And we'll move into the financial assistance programs, which everyone I'm sure is excited about. Our copay relief program was actually initiated in 2004. Right now we assist insured patients only. We have about 15 supported disease categories that range from breast cancer to hepatitis C, prostate cancer, and non-small cell lung cancer. While our prostate cancer fund is assisting patients actively right now, due to limitations in funding, we're not accepting any new applicants at this time, but rest assured that our corporate development office is working every day to find new funders for the prostate cancer program. When we do get funding and we open it up for new applicants, hopefully soon, there is a 6-month look-back period for pharmaceutical copayments, deductibles, and other out-of-pocket costs. So let's say if we happen to open in January, the patient was in chemotherapy treatment or had copays for prescription drugs, the organization can go back 6 months to cover or reimburse for those expenses. One of the newer programs that we have right now is the Radiation Copayment Small Grant Financial Aid Fund. We have partnered with the Livestrong Foundation and the Movember Foundation to offer a $1,000 per year grant to patients that have been diagnosed with prostate cancer or castrate-resistant prostate cancer and are in active radiation treatment. And to make sure that we are reaching out to those that most need those services, we have capped the income limit to $60,000 per year. Grants are provided on a first-come, first-served basis, and I provided the phone number here and also have flyers that you guys can pick up if you know of any patients that can benefit from those services. If any providers have in the past enrolled a patient into our copay relief program, the downside to this program, because of limitations of fundings, we do require that the patient apply on their own behalf. We don't accept bulk processing applications for this program, so the patient does, or the caregiver does have to call in to our toll-free 800 number to apply for assistance. And again, if you or your patient or your loved one does not qualify for financial assistance through the Radiation Copayment Fund or the Pharmaceutical Copayment Fund through Copay Relief, again, we do have case management services that are free of charge, and our case managers will research other programs that may be available to assist the patient through the financial burden of treatment. We have developed, along with our ID department and media department, several interactive online tools and also a mobile app that Android and iPhone users can download and enter in information on the patient, demographic information and diagnosis information to narrow down resources within their area that offer financial assistance. You can also look on our website at patientadvocate.org under the resources section, where you can, if you don't have a mobile phone or are unable to download the mobile app, you can get those services directly from our website as well. We are also on Facebook. Look us up, Patient Advocate Foundation. And we've also created several publications. of which providers and caregivers can download directly from our website, from education on enrolling into clinical trials, the guide to insurance appeals, healthcare reform, Medicare, the disability process. We also provide 25 publications free of charge to provider offices and caregivers if you are unable to download the publications from our website. The copay relief program is available to apply via telephone. We also have an online portal for providers and pharmacies at www.copays.org. And again, although our prostate cancer program is not currently accepting new applications, I encourage everyone to take a look at the website pretty regularly because that fund could open at any time. And because the demand is so high, because of the limitation or the support, unfortunately, for prostate cancer, the funds kind of go quickly, so make sure you're staying up to date. We also send blasts out to our provider offices that have registered patients in the past, so that you'll get first dibs. So if you get that blast, make sure you're telling your patients that the fund is open and to call in and apply. You can also contact patient services or case management department at our toll-free number. There's also live chat available on our website at www.patientadvocate.org. Well, thank you so much. And again, I have flyers available, pamphlets that discuss our financial assistance programs that you can take with you. Something that we're excited about that we actually just initiated with our partners with Livestrong and the Movember Foundation is the Men's Health Initiative. In 2014, I think we served about 2,000 prostate and testicular cancer patients, and we really want to beef up those numbers. We know that education about resources available is lacking. So we've reached out, or our partners reached out to us to really start this initiative to get people through the door that we can refer out for not only financial support or support through the disability process or the Medicare process or insurance process, but also emotional support through our partners. So we welcome any referrals for prostate cancer patients, even if the patient does not need financial assistance, maybe emotional support or just navigation or guidance through their diagnosis. We definitely welcome any referrals that you may have. Okay. Well, thank you so much for having me.
Thank you.